Hello, my name is Ariel Eagleville, and I will be teaching you how to utilize the SPICES tool. So what is a SPICES tool? It helps identify risk factors and obtain information for our older patients, so our geriatrics. So what is SPICES? It's an acronym. So the S stands for sleep disorders, P stands for problems with eating and feeding, I stands for incontinence, C stands for confusion, E stands for evidence of falls, and S stands for skin breakdown. So examples of sleep disorders, questions for sleep disorders that you would ask your patient. So you can ask them how their sleeping habits are, if they're sleeping comfortably in a hospital, how many hours a night do they sleep, and what are their sleeping habits. So questions that you can ask for P, which is problems eating and feeding. Do they have any issues feeding themselves? Do they have any issues swallowing, painful swallowing? If they use dentures, are they able to feed themselves? Do they need assistance? For I, so I is for incontinence. So do they have control of their bowel and bladder? And when was their last BM? If they need a bedside commode. And for C, which is confusion, so any periods of confusion. And if they do, what caused this? For E, so that's if they've fallen, evidence of fallen. So if they've fallen in the past 6 months, and if they need any assistive devices with them to help. And then S, so that's skin breakdown. So are they using any lotions or lubricants for their skin? Do they have any issues with their skin? Do they have any pressure ulcers? So in the video, she actually talked about this, something called a soft care mattress on the bed. And this actually helps with the pressure ulcers. And then also something called hill lift boots, which actually keeps your heels off the bed to prevent skin breakdown. So questions are like the best way to get to gather all your information for your patient to better help them and to assess them. So the question was, what risk factors were identified by the nurse that prompted the nurse to use the assessment tool? So the risk factors that our patient had in the video, Miss Goldsmith, she was 70 years old, African American. She had sickle cell anemia, congestive heart failure, and total hip replacement. So her risk factor was she had a lot of pain. She had a lot of pain, which caused her not to sleep. She had pain in her wrist, which disrupted her from actually feeding herself. And another risk factor was that she had issues. She can control her bladder, but she had to wear protective garments because she wouldn't make it to the bathroom due to this total hip replacement, that she's unable to get up as fast as she can, and she sometimes makes accidents on herself. And also the patient, due to the pain, she's on medication, and the medication makes her confused. So when she wakes up from the medication, she says she falls asleep, she wakes up, she doesn't know where she's at, and she has these bursts of confusion. And it's like all related to just her pain. It all goes back to the pain that she's dealing with. And then her skin breakdown is also like another risk factor. She did say that she did have scars of pressure ulcers on her legs. And let's see. So how was the safety of the patient fostered by using the tool? So the SPICES assessment fostered the safety of the patient by the numerous questions asked by the nurse. It helped identify risk factors and obtain information from the patient. So SPICES promotes early detection and prevention of any possible complications. So what did you learn from this activity that surprised you? So what surprised me about this is that geriatrics was actually seen as you didn't need to obtain that much knowledge. It was seen as less than. That's what she said in a video, that you didn't need enough knowledge to practice geriatrics. And that's obviously not the case. Geriatrics has definitely evolved tremendously. And it's great to see that our older patients are getting the care that they needed. Let's see. How would you incorporate this tool into the SBAR communication with another team? So with the SBAR, you can definitely use it because you're gathering all the information that you need to help your patient. So of course, we got her medical background, like she has sickle cell anemia, heart failure, total hip replacement. She had skin breakdown, and then she needed assistance moving. So like, recommendation could be like she needs PT, physical therapy. And then 5, suggest one way that your fellow students may use this assessment tool during their clinicals. So you can use this every time you have an older patient, every time you have a geriatric patient, you can use this. And the SPICES tool card should be filled out every single time, every single day with your patient. And looking over this can provide you the best care for your patient. Thank you.